Bipolar disorder is this chronic disease that has intermittent episodes of elevated mood. So they go through depression and also elevated moods. There are 4 types of bipolar. There's bipolar type 1, type 2, cyclothymia, and what we call unspecified bipolar. So bipolar type 1 is the most severe, is where patients are so euphoric and so distractible that they're not able to finish any task. While bipolar 2, they tend to be able to have increased activities, but they're able to focus on single things. Cyclothymia is like the lesser of the two. They don't reach a full manic episode, and then they don't reach a full depressive episode. They still have some periods of dysfunctionality between those two, but they are not as severe as the other ones. And the unspecified bipolar, we usually use it when we don't know what's going on yet for the patient. Like they cannot meet criteria for bipolar, but still we want to make sure what is going on. So what makes a bipolar different is actually the name, right? Bipolar, it has 2 poles. It's gonna come with guaranteed depression, but what makes it special is the manic episode, these periods of elevated euphoric mood. So basically extreme happiness, that's how I describe it to the patients. It's bad because it comes with other symptoms. It comes with an increased risk taking activities, so a lot of patients start getting themselves in a lot of issues. They start getting into fights, gambling, speeding cars, drugs, alcohol, so they start becoming dysfunctional in other places. It also starts becoming bad for long-term effects. Every time they go through a manic episode, it gets harder to treat this mania. And in the long run, it starts what we call burning out their brain. It's not actually that it starts burning, but it starts consuming their brain. Patients with bipolar disorder tend to have a little bit increased risk of getting dementia earlier than the average population. When somebody's suffering a manic episode, we look at 7 symptoms. The first thing is that they need to have a change in baseline. Is that this person is not just happy, they're extremely happy. Then they have 7 symptoms. The first symptom, distractibility. Then they have what I call irresponsibility because of their risk-taking activities, grandiosity, flight of ideas, increased goal-oriented activity. Like I was telling you, they do a lot of things, but they're able to clean the house, cook, bake. They do a lot of useful things, but they cannot finish them. They also have decreased need of sleep. They're able to sleep 3 hours and they still function through the day like nothing. And they also develop pressure speech or talkativeness. So we use the little mnemonic DIGFAST to remember the 7 symptoms. The main treatment for bipolar disorder are mood stabilizers, but they can also use antipsychotics or antidepressants. There's 5 mood stabilizers. There's lithium, carbamazepine, oxcarbazepine, valproic acid, and lamotrigine. One of the questions that we get from our patients is like, which one is the best? Because all of us want to be the best medication. No, unfortunately, each patient responds to different medications. Some patients respond better to lithium, some patients respond better to valproic acid. Some patients respond better to combination of medications. Some patients respond better to antipsychotics. But the important thing is to find the right mood stabilizer for this person and for them to keep taking it. It also comes with another thing, because they're gonna experience depression. So they ask us, oh, should I be an antidepressant? We actually advise about being an antidepressant because it can put them into a manic state. However, if they're in a good mood stabilizer, we can use antidepressants. The most commonly used are fluoxetine, sertraline, and bupropion, but any antidepressant can be used as long as they're in a good mood stabilizer. One very important thing if somebody has a diagnosis of bipolar is to not use monotherapy on antidepressants only, as that can worsen their bipolar disorder. And also, unfortunately, our medications can cause issues for pregnancy. So if they have a patient that has female reproductive organs and is during reproductive age, they need to advise this patient to be on contraception and inform them what they can do if the patient decides to get pregnant or wants to get pregnant, if they need to change medications or what is the best course of action for them. One of the issues for patients to stay on their medication, there's several issues. One of them is that they feel depressed because medication will cap the mania, will stop the mania. So they start missing that increased energy, that increased productivity. But unfortunately, we need to remind them that, yeah, it comes with the depression. The other things that they stop their medication is because of weight gain. Patients start gaining a lot of weight. So it's actually good to advise them about diet, but also new things is to maybe include metformin in their treatment. Finally, the other thing that they can develop is somnolence, because this medication is supposed to calm you down, so it puts you a little bit to sleep. So maybe a change in medications, maybe just put it at night, and that would help another patient. Patients that have bipolar disorder and they're not being treated, unfortunately, they have a life expectancy lower than the general population. But actually, patients that undergo treatment, that they see their psychiatrists often, they will be excellent, high-functioning people. Again, there are actors that have been diagnosed with bipolar disorder. There are scientists that have been diagnosed with bipolar disorder. It's just when they're undergoing treatment, they're able to function in society. If there's people that have any concerns of being diagnosed with bipolar, the best thing to do is to find a psychiatrist and ask them why they have these concerns. I usually advise my patients, or whenever I see a patient, is, do you have these concerns? Write it down. That way you can go, when you go to the doctor, you can tell them, hey, I'm having these concerns of being bipolar because of this, this, and this. And that way they can assess you and they can guide you what is the best pathway for you.